Welcome to the 11th annual In Pink event to support Greater Lawrence Family Health Center's Women's Health Care. We invite you to enjoy tonight's festivities as we're proud to present members of the Borslow Insurance staff with the Rosalind Kempton Wood Award, as well as the comedy of Judy Carter and Friends. Now, here's the host of tonight's program, Rich Napolitano.
Welcome and thank you for joining us tonight for our 11th annual In Pink event to support women's health care at Greater Lawrence Family Health Center. We thank you for joining us tonight, and we're thrilled that we're able to still offer this as a virtual event. You know, when I think back to where this event started, I think of the legacy left behind by Rosalind Kempton Wood in the award we named in her honor. And this year, we'll be giving that honor again to a group of women from Team Borslow Insurance. Tonight we'll also hear from a special message from Congresswoman Lori Trahan. Congresswoman Trahan has been a great supporter of Greater Lawrence Family Health Center over the years, and we're thrilled to have her again with us tonight. Some fun facts about Greater Lawrence Family Health Center that you may not know. GLFHC has 7 clinical sites, 2 school-based sites, and we provide health care at 12 homeless shelters throughout the Merrimack Valley. We also have 2 now mobile health units that support the homeless. It supports our vaccine efforts on the street here in the Merrimack Valley. GLFHC, as I said earlier, cares for over 62,000 patients, over half of which are female. GLFHC also fills over 600,000 prescriptions every year. By providing cost-effective quality care, the health center saves millions of dollars every year and provides care to many who might not otherwise get that care without a place like Greater Lawrence Family Health Center. So, every day we're doing the work that this In Pink event supports, and we thank you for joining us tonight. We thank our sponsors for being part of In Pink every year and supporting what we're doing. I encourage you to look at our raffles that we're providing this year. Because we're not in person, we're not able to have an auction or silent auction or raffles. So this year we're doing something online. We hope that you'll take advantage of this. Now, what I'd like to do is introduce our new president and CEO, Dr. Guy Fish, who will welcome you with some opening remarks and present this year's Rosalind Kempton Award to Team Borslow. Thank you for being here.
Well, thank you, Rich. I appreciate the introduction, and I am delighted to be here with all of you in honoring the tradition of lifting up women's health in the Merrimack Valley and through GLFHC. This is our 11th year with In Pink, and in particular, I would like to start off by thanking our lead sponsors, Platinum sponsor Lawrence General Hospital, as well as recognizing the support we've had from our amazing Congresswoman, the Honorable Lori Trahan. Here with us today in video is Lori Trahan.
Good evening. I'm Congresswoman Lori Trahan, and I'm honored to join you tonight for the 11th annual Greater Lawrence Family Health Center In Pink event to support women's health care. While I'm disappointed we can't gather together in person as we have in past years, I'm grateful for the opportunity to be with you all virtually. Like each of you, I'm reminded each year of just how important the In Pink fundraiser is for our community. By supporting the Greater Lawrence Family Health Center's incredible work, In Pink helps so many women battling cancer. The center provides transportation, prostheses, wigs, and other necessities to help make the road to remission and recovery accessible to everyone. This year, I'm particularly excited to honor the memory of local philanthropist Rosalind Kempton Wood, a longtime friend of the Greater Lawrence Family Health Center, whose generosity helped ensure women in need throughout the Merrimack Valley could access critical healthcare services. As the honorary chair of this incredible event, I'm proud to present the 2021 Rosalind Kempton Wood Award for Inspirational Leadership to the team of Jen Borislow, Melissa Marama, Judy Tomeo, and Colette Turgeon of Borislow Insurance. Throughout this pandemic, each of these outstanding women have supported those in need in so many ways. They mobilize teams to provide resources to healthcare workers with meals and personal protective equipment to keep them fueled and safe while they were saving lives. And they delivered care baskets and inspirational messages to let them know how grateful we were for them, especially in the darkest days of the pandemic. They have contributed so much, and we owe them a tremendous debt of gratitude. Now, before we continue on with tonight's event, I'd like to provide you all with a quick update on the important work we're doing in Washington. Right now, we're working to advance President Biden's Build Back Better Act, a once-in-a-generation investment in women and working families across our district and beyond. Specifically, this historic package will lower healthcare costs and improve access to care for millions by strengthening the Affordable Care Act. It will close the Medicaid coverage gap, and it will make long overdue investments in home and community-based care and in ending maternal health disparities. It includes support for community health care centers like Greater Lawrence Family Health Center, organizations that have boots on the ground doing the hard work day in and day out to care for our communities. The Build Back Better Act will be life-changing for so many families in our community, and we're working to get it done. I promised to be brief, so I will stop there. But I just want to say thank you from the bottom of my heart to all of you taking part in tonight's event. Your contributions are essential to the work being done at Greater Lawrence Family Health Center, and we need that stellar work to continue now more than ever. So thank you. Now, I hope you'll join in welcoming our next speakers, Judy Carter and her team, who are going to do a much better job than I ever could in making you all laugh. So thank you again, and I hope to see you all in person real soon.
Just a reminder, throughout tonight's event, you can purchase your chance to win one of the GLFHC mystery boxes. These little boxes are filled with treasures like jewelry or gift cards with a value of at least $20. One gift box has an extra special gift. Thanks to a generous donor, the person who receives the box with the special pink ticket will receive a Kate Spade crossbody bag in light pink, valued at over $200. Each mystery box is $25, which includes shipping. But you have to purchase them early. Boxes are limited. Buy them before they're gone by pointing your phone's camera to the QR code on the screen or by visiting the website listed.
Thank you, Congresswoman Trahan. We really appreciate your support and everything that you do for us to make the delivery of health care and lifting of the health of the community possible. Now, I am honored to present the 2021 Rosalind Kenton Wood Award this evening to 4 amazing women. This award is given to women who provide inspirational leadership, and these women have been exemplary. They have helped continue to support the community in the most difficult of circumstances, yes, COVID-19. Rather than sit back and watch COVID-19 take lives, they each found a way to give back to the community and help others. Jennifer is the founding partner of Borislow Insurance and has set up a culture of giving back that is really spectacular with her company in this community. Melissa has worked around the clock to provide PPE to all of those in need. She helped identify grants to purchase the items needed to source fabric, elastic, and seamstresses for over 70,000 masks, and then set up a system of distribution. Thank you, Melissa. She also set up a system to feed the frontline staff, and complicit with her in that activity were Judy and Colette. Colette and Judy joined this effort to make a reality the distribution of hundreds of food cups and sandwiches to our frontline staff here at GLFHC. Melissa actually helped cheer this activity on and do it in a fun and delightful way by delivering the sandwiches in a Batmobile, and even found a Batman to do so. So it's with great gratitude. Thank you again, Judy and Colette, for your contributions as well. We cannot express enough in words what this effort has meant to the Merrimack Valley and to GLFHC in lifting the health of the community during the most trying of times. So at this point, we will present our awards to the honorees. Thank you very much. So we're delighted to present these awards to these four outstanding ladies in our community, lifting up the community. For you, Jennifer?
Thank you very much.
Thank you so much.
It's a real honor and privilege to partner with you.
Thank you.
Thank you.
Thank you, Melissa.
Great, thank you very much.
Thank you for all you do, Colette.
Thank you.
And thank you, Judy.
Thank you so much.
All right, back to you, Rich. Thank you, everyone.
Thank you, Dr. Fish, and congratulations once again to Team Borislow on receiving this year's Rosalind Kempton Award. Before we move on to the next part of our program, I'd like to remind you that folks can purchase mystery boxes for $25 each. Each one has a piece of jewelry or a gift card in the mystery box with a value of at least $20, and one lucky box has a pink ticket that the winner gets a Kate Spade Layla mini flap crossbody bag with a value of $230. There are a limited number of mystery boxes, so please buy early and buy often. And without further ado, I'd like to introduce to you once again Judy Carter. Judy wasn't able to join us for an In Pink celebration last year, but did provide an opportunity and a great workshop for our frontline staff. So she's here to join us tonight. Judy Carter is an incomparable comedian, stress coach, and motivational speaker. She'll be delivering a routine that will help us laugh at ourselves. She's a stress reduction expert and a rare speaker who is laugh out loud funny and thought-provoking. She's also an international best-selling author of the Comedy Bible and was once interviewed by Oprah Winfrey. Judy shows the humor impaired how to laugh in the face of stress. The results? We will be refreshed, renewed, and revitalized. As Judy says, prepare to be uplifted, and there's no surgery required. Thank you and welcome, Judy.
Okay. Gotta be right.
Yeah. The plug there, Ripple? I think the
Hey! introduction. Thank you so much. That is the best intro I have ever written. I am Judy Carter. I want you to know that I am not in healthcare. I am not a nurse, although sometimes at night I'm asked to dress like one. But hey, people, if you want to laugh, just let it out, okay? Let it out. You've been stressed. I know how stressed you people have been. I was supposed to be there with you and maybe touch people, hug people, laugh with people, but there was something, maybe you heard of it, that happened. The coronavirus pandemic, maybe some of you have heard of that. And next thing that happened after that, because Mary said, no, Judy, this coronavirus, we'll have you in a couple months. Well, that didn't happen. Then a year goes by, and next thing you know, there's the Delta virus. I think they call it the Delta virus because when you check into the hospital Delta, they charge you for your luggage, and it's been, I don't know how you people stand it. Hasn't it been one catastrophe after the next? Hurricanes, climate change, oil slicks. Cher is mounting yet another farewell tour. Disasters. How do we stand it, Lawrence? How do we stand it, Greater Lawrence Family Healthcare Center? How do we bear it? Well, I have a solution for you today. And I'm so excited to share it with you. It's friggin' laugh at it. I'm here to tell you that your life is a joke. Right. Right. And that's the good news, right? That is the good news because, I don't have to tell you, they say laughter is the best medicine. I don't know, the vaccine might be a little better, but I'm just saying it is a good medicine. And I have so much to share with you today. I am so excited. I'm also going to share with you my doctors. Ladies and gentlemen, on today's show, you're going to meet the funniest doctors you have ever seen, Lynette Charity and Dr. Shelby Lane. So we have a great, great show for you. And I'm going to say, don't worry, I am not poking fun of anybody here today because they told me what you people do for a living. And apparently you have enough humiliation in your life without me adding to it. I talked to some of the people here on staff and they told me exactly the kind of stress you people are under. And they explained it to me perfectly. And I still have no idea what you do. So many acronyms. My God, how do you people talk to one another? They said, Judy, we are GLFHC, and we work with NDs and RNs, let me get this right, MAs, PSRs, yay for the PSRs, whatever that is, PSS, the do's, and I guess the don'ts, and the LPAs, and there's a CEO here, who I know is the BFD, that I understand. Judy, this is how Mary explained it to me. Judy, people here have MAs, MBAs, PhDs, STDs, I guess UTIs. Anyway. Judy, Judy, we have it hard. We follow the guidelines of HHS, EOHHS, GLU, Jacko. It doesn't sound like a bad rapper. Oh, Jacko, we dissing you. And then we get an IJ, we get reported to the HRSA, we are SOL. Oh my God, people, it's amazing you give it SHRT, isn't it? I hearing your laughter. I live in Los Angeles and people don't laugh here anymore. Well, they can't. They have too much Botox. Oh my God. You do a joke here, people are like, you're so funny. Look at me, I'm hysterical. Yeah. So I understand you're stressed, but I'm not sure to the extent how stressed you are. We've all heard kind of like what has been happening in healthcare, what you've been dealing with, and oh my God, especially like dealing with people like baby boomers, like myself. We are the crankiest people in the world, aren't we? I mean, how do you deal with patients who are baby boomers? Because, you know, we're the people who go, defy authority. Hell no, we won't go. Hell no, we won't go. And you're the ones who have to say, Mr. Johnson, you've just gone in your pants. Now, please, put the catheter in, for God's sake. Let's take a little stress test, okay, people? Before I introduce my guest, I want to take a little stress test just to see how stressed you are. Okay. All right. So, ladies and gentlemen, here are the top 10 ways you know you are stressed working for GLHABCDEHC. Okay, the top 10 ways you know you're stressed. Here we go. Number 10, you stay in a bad relationship because you can't handle training new staff. That's it. I've had it with that. Number 9. Number 9. When your significant other wants to talk about their emotional needs, you set up a team Zoom call to discuss. I don't have time for anybody's emotional needs, for God's sake. Number 8, when you tell your kids a scary bedtime story, they start off with, once upon a time, there was a surveyor with an attitude. Oh God, it's like stress on top of stress on top of stress. Okay, number 7, when your kids ask you for their allowance, you tell them, sorry, you haven't logged your choice into NHSN. Is that in Massachusetts or not? Okay, number 6. At PTA night, you refer to your children as your residents that never leave. Number 5, during confession, you hand the priest your plan of correction, and he'll find something wrong with it as well. Number 4, when your kids ask for allowance, you tell them they need to fill out expense report and don't incur any overtime. You are completing that task. Number 3, you're so used to wearing a mask that your tan line has been replaced with a mask line and a beard. And you're a woman, so that is not that is not good, is it, people? All right. Number 2, during COVID, you work so much, when you come home, your dog thinks you're a burglar. I don't recognize you. And you look like one too. Oh my God. All right, number 1, ladies and gentlemen, here's the number 1 way you know you're stressed. Number 1, you have no love life because you forget to take off your PPE before you go to bed. So what are we doing here? Like, what exactly are we doing? All you wonderful people at Greater Lawrence and Lesser Lawrence Health Medical Center. What are we doing here? We're taking the very things that stress you out, right? And we're laughing at them. So how does that happen? What's going on in my head when I look at your stress and give you the ability to laugh at it? I want to show you how to do that. I want to reveal the trade secrets of comedians, not so you can quit your job and become a stand-up comic like the physicians I'm going to introduce have done. But so, when stress happens, you could laugh at it, because I want to show you can make a humor choice. You can get stressed out and drink, or you can laugh and drink. That's really what this talk is all about. I just want to show you that, it's really not what happens to us, because most of us go around in this state of anger. We're so angry, going like, oh, these physicians are making me so mad. My patients are making me so mad. I'm just here to say, nobody can make you mad. Someone can make you a daiquiri. Someone can make you pregnant. Usually in that order, isn't it? But nobody can make you mad. You can make a choice. And what about just woohoo, making a humor choice? Because when you do that, you'll see, oh my God, I get it. I'm not in a miserable marriage. It's comedy material, right? I'm not dealing with the heckler, the patients from hell. They're hecklers, right? It takes an effort to see life as a comedy rather than a tragedy, doesn't it? It takes an effort, but there's nothing you can't turn into a comedy. Like, oh, I get it. My son wasn't arrested drunk on the TV show Cops. I have a relative in show business. How do you see your life, people? Do you see it as a comedy, or do you see it as a tragedy? Because we can't stop stress from happening. As soon as you get to work and you pick up your voicemail, what do you hear? But you're not doing it right. You're not really sensitive to others. You're not really listening. And that's your husband. Then you have patience, It's just, So today, I want to show you how to see your life as a comedy. And I would love to introduce to you, I teach comedy workshops. And, like people like Jerry Seinfeld and Jay Leno, yeah, they didn't take my class. Seth Rogen did. Seth Rogen took my class. Hannah Gadsby took my class. And, we start off the class with not what's funny about our life, but what sucks. And then we learn, oh my God, I get it. This isn't a bulging waistline. This is a punchline. I don't have a receding hairline. It's a punchline. There is nothing we can't joke about by just going, woohoo. And I'm so excited to present my friend who's joining us today. I want to give her a really great intro because she is fabulous. Now, Dr. Lynette Charity she's amazing because her specialty is putting people to sleep. Right? You know what she is? What is she? What kind of doctor is she? Come on, what is she?
Anesthesiologist.
Anesthesiologist. Not really good for a stand-up comic. She puts people to sleep, and she has been a physician in the U.S. Army. She's an independent practitioner, and she's been a hospital employee. She really knows what you go through. And after suffering her version of burnout, she made a big decision to become a stand-up comic. And in the process of learning stand-up comedy, she learned techniques on how to deal with disgruntled patients, demeaning colleagues, and disrespectful administrators. And she currently is living in Gilbert, Arizona with her physician husband. How that works out, I have no idea. But she's here from where she's vacationing in Hawaii. Ladies and gentlemen, a warm welcome for Dr. Lynette Charity. Woohoo! Lynette!
Hello. Aloha. GLFHC coming to you live and in living color from the big island of Hawaii. Hashtag love Lawrence. And I just have to give a quick shout out to Dr. Lance Bray, along with Mark LeMay. Saw your podcast. I got some kombucha here and a little turmeric. I'm going to try these natural remedies. We'll see if it works. I don't know. So let me just say something about the fact that, as I pull up my straps here, let me say something about the fact that, here I am in Hawaii, and I'm a physician, that you know. I am a physician. And we take our jobs very seriously, as Judy was saying. But I'm here to prove to you that being a physician is a joke. Now, don't get upset, all you family practice residents out there, hear me out. So by day, I'm a physician, but by night, I'm a comic. And sometimes I get those mixed up. So there I'm in the hospital, I'm going, hey, everybody, how's it going? Where you from? What you doing? Drink up. 2 drinks minimum. Oops, you're my patient. I was wondering why you were in a hospital gown. Oh, my bad. So, as a Black female, if you didn't notice that already, I have always wanted to be a physician. I've always wanted to be a physician because I wanted some RESPECT, find out what it means to me. So just a little respect, just a little bit, okay? Then I became an anesthesiologist. What was I thinking? What was I thinking? We anesthesiologists get no respect. No respect. We're like the Rodney Dangerfields of medicine. I don't like my patients awake. I don't like my patients awake. So annoying. Asking so many questions. Doc, does this look infected? Doc, does this mold look cancerous? Doc, why so much anal? Really? Do I look like a family practice doc from GLFHC? No. Time to go to sleep. So, we anesthesiologists, we're like ninjas. Yeah. We come down from the OR ceiling and we go sleep. When the patient wakes up in the recovery room, what the hell happened? How did I get here? Love it. And they don't remember us. Thank you. Versed. I love that drug. And for you family practice docs out there, I don't know if you've had this problem, but we do what we do well. So why is it that patients challenge us? Doc, what are you doing? Doc, let me just tell you, I bet you that I can stay awake. You can't anesthetize me. Oh, really? You think that, huh? Yeah. I bet you I can count back past 100 all the way to 70.
Yeah, so you might.
If I retire.
Hold on.
which
So
I
if you can
plan on
time it that way.
retiring.
Okay, that works.
So then
There's something. I hear music, I hear talking, I hear everything. Not sure where that's coming from. I will resume what I'm saying because the joke. So listen up. So he goes, I bet you I can do this. I said, okay, all right, try it. Let's do it. All right, I'm ready to count. You ready? Okay, right. 100. Let me just tell you, once you sleep with a pro, out you go. Okay. Just remember that. So, any of you docs out there, or any of you ever had a patient say that they're afraid of needles? Yeah. So, patient goes, Doc, I don't want an IV. It's gonna hurt. I'm afraid of needles. Really? Really, Mr. Johnson? You got 2 nipple rings. You got one in your nose.
Oh.
Give me a break, okay? And then we have this issue. We talk about connection, because that's the big thing now. We want to have good Press Ganey scores, right? So we need to have this good connection with our patients. But then we have this problem where they look us up on Google, and then they're always looking for something bad. For anesthesiologists, it's we give too much anesthesia, we give too little anesthesia, we use the drug that killed Michael Jackson. So, Doc, I looked you up on Google, and I don't want that drug. You know that drug called propanol? I don't want it. You killed the king of pop. I didn't do no such thing. Yeah, and it's propofol. Yep. And I sometimes wonder, even now, after all these years, why we still do what we do, because it's hard. It's hard. It's hard what we went through. And just think about it. We did 4 years of college, 4 years of medical school, 4 years of training, and more, maybe. And all that toil and whipping us into shape and not paying us any money. It's like the medical version of 12 years a slave. Yeah. Oh my goodness. So I went to medical school in Boston. Yeah.
Woohoo! Woohoo!
At Tufts. Some of you may have heard of it. I parked my car in Harvard Yard, but I went to Tufts. And I went to medical school in the 70s. And as a Black female, it was a little scary, basically because there was a lot of racial tension, unlike now. And so while I was there, I would have to ride the bus, and I was always concerned about how the locals would react to me. I had a nice fro back then. And I would get on the bus, and invariably, some little old white lady would look at me and turn up her nose and go, "You know where you belong, in the back." Not because I was Black, no, because I smell like dead people. What's the matter with me? And sometimes they go, "Oh, what's that smell? And I go, "Oh, that's my new perfume. You like? It's called formaldehyde." Occasionally I wear cadaver musk, but my favorite is Simply Embalm. So I've been married to the same man for 42 years. So give me a shout out, whoop whoop on that.
God help you.
It's work in progress. Anyway, he's white. Now, you can imagine in the 70s what it might have been like for both families for us to talk to them about our impending marriage. My mother, good Southern Baptist woman, "I don't want my daughter marrying no hunky." Mom, he's a doctor. He's a doctor. Do tell. Oh, okay. Hallelujah. Praise the Lord. We're going to have a doctor in the family. And I go, Mom, I'm a doctor. Yeah, but you're just anesthesia.
Give it up for Lynette. Lynette, are you still putting people to sleep in a hospital?
I am not.
Ah, really?
You know,
All
I
right.
put people to sleep when I chat now, when I talk to them. People my age, I'll just say.
Is it harder being a stand-up comic than being a doctor?
It is harder being a stand-up comic. Yes, it is. You know, because I put my patients to sleep. I don't have to talk to them. I actually have to interact with people when I do comedy. Oh my, that's a weird sensation. Everybody's looking at me.
Well, give it up once again for Lynette, everybody. Thank you so much for Lynette. Oh my God, isn't it great? See, so I'm going to introduce my second guest today, who is just so interesting. She does so much. She's a graduate of the University of Michigan Medical School and Second City Comedy School in Chicago. She's a doctor by day and a comedian by night. She was even interviewed, listen to this, people, by NASA to become an astronaut. She's an emergency medicine doctor. Imagine that stress. She performs in comedy clubs and most recently in parking lots, creating laughter. Imagine that passion and dopamine surge. She's also a board-certified anti-aging doctor and a graduate of the Harvard Stress Management Program. So please give it up for the hilarious, ladies and gentlemen, it is Dr. Shelby Lane. Dr. Lane, come on out here.
Woo!
Thank you. Thank you so much, Judy. Fabulous introduction. Golly, you're great at making that stuff up. And I want to thank you, Greater Lawrence Family Health Center, for inviting me today to shine a little light on all the darkness in the world. So I work in healthcare, just like all of you. What in the health is going on? Like statistics say that healthcare workers are suffering from burnout. I beg to differ with you. Healthcare workers are burnt up. They're burnt up. I think I smell a lot like Dr. Charity's formaldehyde right now. Even through Zoom, you can probably smell me. So, you know from my intro that I'm not a nurse. I don't have those kind of skills, like listening and caring and a box of Kleenex. I just don't have it. No, I'm just a doctor. I'm a Detroit emergency physician. So, baby, I'm the doctor in the hood. So I'd like to shout out to all my homies. I see you out there. I see the office. I see you. You're behind the office. I see David Hall, Helen Phillips, Abigail, and I see 978-885-6134. Come from behind the screen, everybody. Come on out and laugh. But my favorite frontline workers are nurses, paramedics, and postal workers. Yes, the postal workers, United States Postal Service, because postal workers have done me right. They did me right. They showed up right on time every day. They were like, Dr. Lane, here's your packages with everything you need to survive the pandemic from the Home Shopping Network. I have 180 pair of new shoes. So anyway, I spent my entire life doing CPR in the ER, on bathroom floors, and at the corner of Carjacking Boulevard and Manslaughter Ave. You heard me right. I'm the doctor in the hood, and I'm doing what I should. So I do have some skills. I have a license to carry a stethoscope and a gun. So I can take you out if I have to, but I can also bring you back if I want to, only if I want to. So it's hard. Look, it's hard working on the front line as a doctor nowadays. It's not the gunshot victims. It's not the responsibility of saving someone's life. You know what's hard about it? It's the freaking Yelp reviews. because we get rated right out there on the internet. Did you know that people can leave us a bad rating, like I'm some sort of cheap restaurant and I just served you soggy fries at Applebee's? At Applebee's? No, like this actually happened. A patient came in, CPR in progress, gunshot wound, and I saved her life. And she gave me a 1-star review. 1 star. 1 star. She said, her review said, well, sure, Dr. Lane saved my life, but her hair was a mess and she had an attitude. I'm like, attitude? Like I haven't heard that before. Sweetie, I live in Detroit. I can put a toe tag on you that says, oops. But you came into a hospital, not the Ritz-Carlton, and I'm not a server at Applebee's. And then she went on to say, well, all I asked for was a prescription for a lifetime supply of Vicodin, and she, the doctor, had the nerve to say no. 1 star. So, I had to respond. I have to. So I said, Mrs. Jones, I'm so sorry. I was having a bad hair day as I was snatching your butt back from the jaws of death. You can't give me 2 stars. You gave 3.5 stars to the gas station where you were shot. So every day I hear anxiety is at an all-time high. And actually, I'm just talking about my anxiety. Why? Because I'm constantly on, smiling behind the mask. Sometimes the stress is so high. I'm so glad I took those acting classes at Second City. And I could snap at any moment. Because a lot of doctors and nurses and postal workers snap. They do. They resort to booze and, opiates just to cope. And I am going to admit to you right now, I'm a user of one of the things that could actually really kill you. Rocky Road ice cream, baby. Rocky Road. And I'm up to a pint a day. Look, some people may be killed by Jim Beam. I'm afraid I'm going to be killed by Ben and Jerry. So Judy gave you all that fabulous information about how to recognize stress and maybe how to deal with it a little bit. And I think it's important for you to take care of yourself. So I always advise people, pamper yourself, go on vacation, get a divorce. All right. And so I did what any normal person would do during the pandemic. Normal people, I applied to be an astronaut. Again. And the operative word is again, because what woman doesn't want to be weightless? I call that diet 0G, baby. So they're like, so how much do you weigh, Shelby? I'm like, nothing. I finally reached my ideal weight. So I did say again, because back in the day, I interviewed with NASA to be an astronaut at Johnson Space Center. And at NASA, they tried to scare me so I wouldn't want to be an astronaut. I'm like, NASA, you can't scare me. I've been locked in the trunk of a 1974 Buick Skylark on several occasions. And those were dates. Because I'm from Detroit, baby. So my friend said, girl, you are delirious. You are too old to be talking about being an astronaut. I'm like, too old? William Shatner, Captain Kirk, just got back from space today, and he's 90 years old. If they let that old gas bag up there, anybody can go. Anybody. So it's a good thing they didn't let him drive, because he would have kept the left blinker on the whole time. So just when I go to space, because I am, I'll have to pack light, because the last time I flew, the flight attendant said, ma'am, extra baggage is not allowed. And I said, ma'am, that's my butt. Thank you very much. I'm Shelby Lane. Thank you.
Thank you. Woo!
I know everybody's like going like, well, that's a joke, right? It's a joke about,
For
it's a
real.
joke about NASA. What?
It's for real. See my space stuff behind me, my memorabilia.
Oh, yeah.
I'm going. I'm going.
Wait, you're going up in the Edmund Musk capsule? So where are you going? You're going like,
No, I applied to be an astronaut again and again, so twice this year, and I got selected with Discovery Channel for Who Wants to Be an Astronaut. I'm one of 10 finalists, and if I win, you got to vote for me. You got to vote for me. I will go to the International Space Station for 8 days. I will not go to the edge of space. I will go to deep, dark space.
So cool. So cool.
that is awesome. I can't wait to see your set from the space station. And hope the reception is a little bit better.
A little better,
my
right?
God. Give
I
it
like
up for
I like
the
NASA.
doctor in the hood. Give it up to the doctor in the hood.
Thank you.
Thank you, Shelby.
you.
Both Lynette and Shelby took my class. I just had to invite them here and talk to you about the humorous side of being a doctor. People, there is always hope. There is always laughter. And now I would like, let's just say Shelby and Lynette to join me, and we are going to sing for you. That's right. Okay, when I point to you, everybody just go, it's not fair, right? Because isn't that how most of us feel? Oh, it's not fair, right? It's not fair. But I'm saying that life, if you want fair, go to Ohio. There's a whole fair there. Okay, so, all right, right? This isn't fair, for God's sake. All right, so here we go. I'm going to hit myself with a beat. Can you hear this?
Yep.
Yeah, whoa. Sorry, I'm the white one. Why is the white one rapping? Okay, here we go. Wait, I screwed up already. Healthcare is my vocation, not getting me much appreciation. Always in a crisis situation. No wonder I'm on medication. Say yo.
Yo.
Help me, people.
Yo.
My pants are tight. My form is warm. I can't fill out one more form. I need some air. It's not fair. I need some air.
It's not fair.
Requirements are out of hand. Millions of pages, impossible to understand. What is really deranged? As soon as I learn them, they will change. It's not fair.
It's not fair.
What's your feet? You're out of rhythm. Okay. Needing to see why my budget is late. Needing to see why I can't hit my date. Want to know why I'm not completing. Cause I'm at a friggin' meeting. It's not fair.
It's not fair.
Now what makes us go berserk when people call us jerks? We're sick of this devaluation. So let me tell you without hesitation, you want your patients to get medication. Treat us with appreciation. So let me give you an education. We would like innovation. We're the backbone of this organization. Woo! Thank you, Shelby. Thank you, Lynette. I have to tell you, it's been tough. I've worked Vegas, I've worked Atlantic City, and now I'm working a freaking rectangle. But I wish I could see you. My heart is all with you. We all wish you great holidays, and let's get rid of this friggin' virus. Let's take off our masks and let's enjoy life again. Thank you so much. Take care, everybody. Good night.
Just a reminder, throughout tonight's event, you can purchase your chance to win one of the GLFHC mystery boxes. These little boxes are filled with treasures like jewelry or gift cards with a value of at least $20. One gift box has an extra special gift Thanks to a generous donor, the person who receives the box with the special pink ticket will receive a Kate Spade crossbody bag in light pink, valued at over $200. Each mystery box is $25, which includes shipping. But you have to purchase them early. Boxes are limited. Buy them before they're gone by pointing your phone's camera to the QR code on the screen or by visiting the website listed.
Thank you, Judy. That was tremendous. And I want to thank everyone for joining us as we celebrate In Pink this year. It's been a really tough 18 months. And we look forward to seeing you hopefully all in person next spring for our Making a Difference Gala, which will be in April like it is every year. What a great night this has been, and I want to thank all of you for your continued support of Greater Lawrence Family Health Center. What we have witnessed tonight will continue to help the health center make a difference in the lives of so many people throughout the region. This truly is a special place where people come to work every day with a passion to provide the highest quality health care to those that need it most. Thank you for being part of it, and thank you for helping us to support women's health care at Greater Lawrence Family Health Center. Mystery boxes, which I mentioned earlier tonight, may be purchased through midnight on October 31st and will be shipped out the week of November 1st. The winner of any of the raffles will be notified on November 1st, and arrangements for pickup will be made then. Thank you once again for joining us for this year's virtual In Pink celebration. Have a wonderful evening.